A muscle spasm is a sudden and involuntary contraction of one or more muscles. These contractions can happen without any warning and can be quite painful. Imagine your muscle clenching up without you telling it to. That's a spasm. It can occur during any activity, whether you're working out or simply sitting still. It's like a sudden cramp that takes you by surprise, often leaving you momentarily immobilized. These spasms can occur in any muscle of the body, but they are most common in the back, legs, and feet. They can strike at any time, making even simple movements difficult. Think about a time you might have experienced a Charlie horse. That's a prime example of a muscle spasm in the leg. These can be particularly painful and disruptive. Muscle spasms can range in intensity from mild twitches to severe pain. Sometimes they are just a minor annoyance, but other times they can be excruciating. It all depends on the muscle involved and the underlying cause. Factors like dehydration, muscle fatigue, and electrolyte imbalances can contribute to spasms. The good news is that most muscle spasms are harmless and resolve on their own within a short period. Simple measures like stretching and hydration can help. However, frequent or severe muscle spasms can be debilitating and interfere with daily activities. They can make it hard to perform even the simplest tasks. Understanding the causes, symptoms, and relief methods can help you manage this common ailment effectively. Consulting a healthcare professional can provide additional strategies for prevention and relief. Muscle spasms can arise from a variety of factors, ranging from simple overuse to underlying medical conditions. These involuntary contractions can be quite painful and disruptive, affecting daily activities and overall quality of life. One of the most common culprits is muscle overuse, often seen in athletes or individuals engaging in strenuous physical activity. When muscles are pushed beyond their limits, they can become fatigued and more prone to spasms. Imagine pushing your muscles too hard during a workout without proper warm-up or stretching. This can lead to muscle fatigue and trigger spasms. Proper preparation and gradual increase in intensity are key to preventing such issues. Dehydration is another frequent offender, as it disrupts the balance of electrolytes in your body, which are essential for proper muscle function. Staying hydrated, especially during and after exercise, is crucial to maintaining this balance. Other causes include mineral deficiencies, particularly low levels of magnesium, calcium, or potassium. These minerals are vital for muscle health, and a deficiency can lead to frequent spasms. These minerals play a crucial role in muscle contraction and relaxation. Ensuring a balanced diet rich in these nutrients can help prevent muscle spasms. Certain medications, such as diuretics, can also increase the risk of muscle spasms as a side effect. It's important to be aware of these potential side effects and discuss them with your healthcare provider. In some cases, muscle spasms can be a symptom of underlying medical conditions, such as nerve compression, spinal cord injury, or multiple sclerosis. These conditions require medical attention and proper management. If you experience persistent or unexplained muscle spasms, it's crucial to consult with a healthcare professional for proper diagnosis and treatment. Early intervention can help address the root cause and prevent further complications. Muscle spasms often announce their presence with a distinct set of symptoms. The most common symptom is a sudden onset of pain, ranging from a dull ache to a sharp, intense sensation. This pain is typically localized to the affected muscle and may worsen with movement. Another telltale sign is muscle tightness or stiffness. The affected muscle may feel hard to the touch and resist stretching or movement. This can limit your range of motion and make it difficult to perform everyday activities. In some cases, you may also notice a visible twitching or knotting of the muscle. This is a clear indication of the involuntary contraction taking place. The duration of muscle spasms can vary widely, from a few seconds to several minutes or even longer in some instances. When a muscle spasm strikes, there are several steps you can take to find immediate relief. Muscle spasms can be sudden and painful, but knowing how to respond can make a big difference in your recovery. The first line of defense is often the simplest: rest. Allowing your body to relax can prevent further strain and give your muscles a chance to recover. Gently stop the activity that triggered the spasm and give your muscle a break. This is crucial to avoid exacerbating the injury and to start the healing process. Applying heat to the affected area can also provide soothing relief. Heat helps to increase blood flow, which can reduce stiffness and promote healing. A warm bath, heating pad, or warm compress can help relax the muscle and reduce pain. The warmth can be particularly comforting and can ease the tension in the muscle. Conversely, applying ice can also be beneficial, especially in cases of acute injury or inflammation. Ice helps to numb the area and reduce swelling. Wrap an ice pack in a towel and apply it to the area for 15 to 20 minutes at a time. This can help manage pain and control any swelling that might occur. Over-the-counter pain relievers like ibuprofen or naproxen can help reduce pain and inflammation. These medications can be very effective in managing the discomfort associated with muscle spasms. Massage therapy can also be helpful in relieving muscle tension and promoting relaxation. A professional massage can target the specific muscle groups that are affected and provide significant relief. Gentle stretching of the affected muscle can also ease the spasm and improve flexibility. Stretching helps to elongate the muscle fibers and can prevent future spasms. While not all muscle spasms are preventable, certain lifestyle changes and precautions can significantly reduce your risk. Staying properly hydrated is crucial, especially during physical activity or hot weather. Aim to drink plenty of water throughout the day to maintain electrolyte balance. A balanced diet rich in fruits, vegetables, and whole grains can provide your body with the essential nutrients, including magnesium, calcium, and potassium, that support healthy muscle function. Warming up before exercise and cooling down afterwards are essential steps to prepare your muscles for activity and prevent injury. If you have a sedentary job, make an effort to get up and move around every hour or so to prevent muscle stiffness. Maintain a healthy weight, as excess weight can put extra strain on your muscles and increase your risk of spasms. Section 6. Exercise and stretching. Gentle movements for relief and prevention. Regular exercise and stretching can work wonders in both relieving and preventing muscle spasms. Engaging in low-impact activities like walking, swimming, or cycling can improve circulation, strengthen muscles, and enhance flexibility. Specific stretches targeting commonly affected muscle groups can be particularly beneficial. For example, hamstring stretches can help relieve and prevent spasms in the back of the legs. Calf stretches are useful for addressing spasms in the lower legs. When stretching, remember to move slowly and gently, holding each stretch for 20 to 30 seconds without bouncing. Avoid overstretching, which can further irritate the muscles. Incorporate these stretches into your daily routine, especially after exercise or periods of prolonged sitting. Section 7. Debunking myths, separating fact from fiction on muscle spasms. Several myths and misconceptions surround muscle spasms, often leading to unnecessary worry or ineffective treatments. One common myth is that all muscle spasms are caused by dehydration. While dehydration can certainly contribute to spasms, it's not the sole culprit. Other factors, as discussed earlier, play a significant role. Another misconception is that stretching is always good for muscle spasms. While gentle stretching can be helpful, aggressive stretching during a spasm can actually worsen the situation. It's crucial to listen to your body and avoid any movements that exacerbate the pain. Some believe that muscle spasms are always a sign of a serious medical condition. While it's true that spasms can be a symptom of certain conditions, in most cases, they are benign and resolve on their own with simple self-care measures. Section 8. When to seek medical advice. Persistent or worsening symptoms. While most muscle spasms are harmless and self-treatable, certain situations warrant medical attention. If your spasms are severe, persistent, or worsen despite home care, it's essential to consult with a healthcare professional. Similarly, if your spasms are accompanied by other symptoms like fever, redness, swelling, or weakness, seek medical advice promptly. These could be signs of a more serious underlying condition requiring specific treatment. Unexplained muscle spasms, especially those that come on suddenly without an obvious trigger, should also be evaluated by a doctor. Early diagnosis and treatment of any underlying medical conditions can improve outcomes and prevent complications. Section 9. Prioritizing muscle health. A proactive approach to wellness. Muscle spasms are a common ailment that can disrupt our daily lives. By understanding the causes, symptoms, and relief methods, we can effectively manage and prevent these involuntary contractions. Prioritizing muscle health through hydration, balanced nutrition, regular exercise, and safe stretching practices can go a long way in preventing spasms and maintaining overall well-being. Remember to listen to your body, warm up before exercise, and stay hydrated. By adopting a proactive approach to muscle health, we can minimize the occurrence and impact of muscle spasms, allowing us to move freely and comfortably through life.